Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Now we have proliferative diabetic retinopathy. In the proliferative diabetic retinopathy, there can be neovascularization can be common. This neovascularization can be neovascularization at the disc, or it can be neovascularization elsewhere, neovascularization at the disc, neovascularization elsewhere, or it can include rubeosis or iridis, and also this also includes neovascular glaucoma. Okay, so these are the four types of neovascularization. Then we also have retinal detachment is also seen in diabetic retinopathy. This retinal detachment, initially it is fractional retinal detachment, which can later lead to hematogenous retinal detachment. Hemorrhages can also occur in the diabetic retinopathy, like intravitreal hemorrhages or pre-retinal hemorrhages will also occur in diabetic retinopathy. Intravitreal hemorrhages and pre-retinal hemorrhages can occur in diabetic retinopathy.
thank you and thank you for watching.